Hey guys, and welcome back to Women Empowerment Wednesday. So today we have the beautiful Dr. Ekta out of New York, and she actually is from India. She did her dentistry school out there, but then she also did it here. She's a mom, so she's just going to talk to us a little bit about motherhood, her journey in the dental industry, and all the things in between. So would you please tell us a little bit about yourself?
Um, so I graduated from dental school in India back in 2011,
Okay.
and then I moved here in 2012, and I've been to different states, to Texas, New York, then back to Texas. My
Mhm.
family currently resides in Phoenix, Arizona, and I'm in New York, and I'm
Nice.
practicing dentistry, and I have a 3-year-old, and I'm doing wearing multiple hats.
Yes, and I commend you for everything that you're doing. And I can't wait to dive into this interview because, guys, I'm going to learn a lot from her, but you are as well. So, just to start off, so you grew up in India with a single mom. Do you feel like that shaped you and your view of independence and womanhood early on?
I think it did deeply affect me on like how my childhood has shaped me. Growing up with a single mom in 90s India was very uncommon.
Okay.
Um, and watching my mom navigate her life has shaped me very differently. Um, I saw her resilience and dependence and consistency. And from that very young age, I learned that nobody's going to come and save you. You have to
Right.
show up for yourself, you have to pull yourself out of the darkest moments. And I also learned that you have to choose yourself, becoming comfortable with your own company, and you have to build your inner strength before seeking validation from the world.
Yeah, and those are a lot of great different points. And like you said, resilience is huge. Like, especially when you're a mom, as you know, and then I'm a mom too. Like, we don't have a choice. At the end of the day, we have a little person that's looking up to us. So we have to push through like our emotions and how we may feel that day in order to make sure our baby is okay. So I think that's huge. And so I'm happy that again you utilize that because sometimes I think like when our parents separate, we sometimes blame ourselves or we go through these different emotions. Because I know when my parents had got a divorce, I blamed myself a lot. And it really didn't have anything to do with me, but sometimes we take on that extra guilt that we don't need to. Um,
And
you're
I always grew up with the fear that, like, people are not going to choose me,
mhm,
or you become a people pleaser, or you have a fear of like everybody's going to leave me alone.
mhm.
And so yeah, it's a journey that took me a while to get over that fear.
Yeah, and so I'm happy for you. So then, throughout your life, you grew up. So at what point did you realize that you wanted to go into being a dentist? And what drew you to it?
So dentistry came more naturally to me. Like, as a kid, I always was into art, and
Mhm.
as I grew into high school, I started developing more interest into science and human biology. So
Okay.
dentistry kind of felt like a perfect combination of art, science, human connection, and also the fact that my mom had a lot of cavities, and I spent my childhood at different dental offices. So it was just a very familiar environment. Like, I knew what to expect of like dental offices and stuff like that. So
Hmm.
when I had given a choice to get into medicine or dentistry, I think I was naturally like more drawn towards it.
And I love that because you hear so many people who are scared to go to the dentist and they're like fear,
I
but you like
know.
embraced it because you were always there. So that's definitely neat and something different.
Yeah.
So the next question is, what was like the biggest cultural adjustment that you had to do transitioning from India to the US?
Um, I think that biggest cultural adjustment was learning how approachable people are in US. So India, if you ask too many questions or if you ask for help, that people look down on you, like you don't know that much, or like it's frowned upon, it's discouraged.
Yeah.
So it took me years to kind of, open up, be comfortable speaking up, asking questions, seeking guidance. But once I did, it opened up many doors for me, both
Okay,
personally and
nice. Nice, nice. And then how would you say that your experience in dental school was different in India versus practicing here?
so dentistry was very different in India in the sense like it created a very strong foundation for me. It
Okay.
helped me to like emphasize more on didactics, and
Mhm.
also the patients that you see is like more volume of patients you see, so it helped me improve my hand skill versus the dental school here. It's more comprehensive,
Okay.
building trust and relationship with patients. So I want to say that kind of helped me build the quality of dental care. So I
Okay.
feel like I learned quantity and quality, and it helped me to emphasize my career in both the ways.
Okay, nice, nice. And doing that transition, because like going to school for dentistry is not an easy feat at all. What do you feel like kept you grounded during the moments where things felt overwhelming or uncertain in general?
So I'm a very spiritual person, and
Okay.
I want to say like thanks to my mom, but my faith, spirituality, close
Hmm.
relationship with like inner circle of friends.
Hmm.
Um, so whenever I go through difficult times or life becomes overwhelming, I tend to retreat inward. I
Okay.
reflect, meditate, pray. I reconnect with myself, and I lean heavily on like close friends and family. And those quiet moments of introspection and support that helps me navigate through difficult moments.
Okay, perfect. So, guys, if you missed that, rewind a little bit because she definitely dropped some gems. Because it may look different for all of us, but at the end of the day, whatever brings you back to like your core purpose and is a calm state. Like it's important for your nervous system to be calm. That's where you need to revisit and go back to. But okay, so let's shift gears a little bit because you're a mommy. How do you feel like becoming a mom shifted your identity as a woman and then as a professional too? Because again, you've been doing this for 10 years.
So becoming a mom changed me in a ways I never expected. Like it made me softer. It made me more
Hmm.
compassionate and more understanding. Um, so it made me softer, but also stronger because now I'm more patient with my team members or with my
Hmm.
patients. It learned me it like I learned to give grace like to other people. So
Nice.
for a long time I was I was always very career focused. So I would
Okay.
be very intense. I micromanaged. I pushed myself very relentlessly, and I expected the same from everybody that worked around me. Uh,
Right.
so when I became a mom, I kind of reevaluated my priorities. Was I realized that just being career focused or having professional achievement is not like that doesn't make everything accounted for you. So that's
Mhm.
where like it made me a better person but also a better human being.
Okay. Okay, nice, nice. And then like I know like you said you were super like career focused. Was there ever like a moment where you felt like you had to choose between being present at home with your baby and then excelling in your career?
Absolutely. I think
Yeah.
uh, most of the pressure came from myself. Like it wasn't like I had somebody telling me that you have to do this. But
Yeah.
after becoming a mom, I felt like I disconnected from my career. My focus became more towards my home, my family, my kid. Uh,
Mhm.
and I questioned myself, what am I professionally? And it took me some time to understand what I want to become and what
Mhm.
my identities are. And it doesn't have to compete with one another. Uh,
Right.
and I can find a balance. I mean, it's a constant work in progress. Like it's some days
Mhm.
I'm great mom, some days I'm great dentist. Yeah, it's change. It changes every day.
Yes, and what I've learned, especially because like for a couple years, I'm like, okay, I need to have this balance. I need to have this balance. What I've learned being an entrepreneur and a mom is that there's no such thing as balance. Like you said, one day, like
Yeah,
it's going to be 90%. I'm better at work, 10% at home, and then vice versa. So it's like we just have to be comfortable with that and just know like we're showing up as our best selves. Whoever gets the best version of ourselves is either work or a family, but we're still
absolutely.
great people, at the end of the day. So I think that's huge that you mentioned that. And then I know previously when we had did like our talk, we talked about like postpartum depression. What did that look like for you personally?
So postpartum depression was like one of the darkest period of my life. Like I
Yeah.
remember being like in a very dark place where I felt like there was a constant dark cloud hovering over me. I was
Hmm.
worried about everything, like even smallest problems felt overwhelming. Like some
Hmm.
days are like blurry in my memory, and some days are very incredibly vivid. Like I remember
Yeah.
exactly what happened. And I remember being exhausted like all the time. I've never experienced anything like that before, like emotionally, physically, and it generally felt like my world was falling apart, even it may not
Yeah.
appear to like other people from outside. Like looking back, like I felt like some of my fear seems irrational, but in that moment they felt very real.
Yeah.
And that's what I want to tell, like, that's why we were chatting, and I want to
Mhm.
tell like women who are going through that right now, because when I brought up those concerns, I remember talking to my OB and like the nurses, and they're like, "Oh, it's fine. It's just hormones, and it's
Mm.
okay if you tear up. Like, it's just your hormones." Many like I remember telling them like I cry all the time, and they're like, "Yeah, that's normal." And I don't think so. They guided me towards like, "Hey, you need to see a therapist, or you should
Mhm.
talk about it, or anything like that." And that's when I felt like, and I talked to other girlfriends who went through similar things, and none
Yeah.
of them had an experience where they guided them, like, "Oh, yeah, you need to do physiotherapy, or you need to do uh, see a chiropractor." All that stuff was
Mhm.
discussed. Never like, "Oh, you need to see a therapist." That was never discussed.
Right. And so like I think that's huge. So first off, thank you for opening up and bringing that up because like you're successful, you're beautiful, you've traveled the world, you've done a lot of things and it's like something still this traumatic happened to you. And I feel like it happens to a lot of women. And again, like you said, a lot of people don't have the resources or the doctors kind of like push you off to the side like, oh, go home, you'll be okay, or oh, maybe you just need to get some more sleep, but it's a real diagnosis that I feel like should be taken so seriously. So thank you for letting people know that it's normal, you know what I mean? And so like besides like always crying and like being sleepy, were there other signs that made you realize that you needed that support?
So I remember like being deeply unhappy, like,
Okay.
things. I remember like, people would look at me. I was still going to work. I was still doing dentistry, and I was doing good work. It wasn't like I
Hmm.
was compromising care. I was still doing all the chores and talking to friends, but I became irritable. Like I remember you take it out on the people who are closest to you. So my very close relationship were like
Hmm.
strained. I remember being emotionally drained and disconnected. And sometimes, when you bring up things to your friends and family, and they're like, "Oh yeah, it's fine," and
Hmm.
whoever said it's fine, I was like, I retracted from those people, and
Yeah.
there were some moments of anger outbursts which I would take it out on my husband or my mother, or close people that would just, and eventually I realized I need to stop pushing, and they were like, you need to seek help. And that's when I was like, I actually started working on myself, on healing.
Yeah. Okay. And then, like, that was going to be my next question. How did therapy play a role in your healing journey?
So therapy helped me to heal wounds that I didn't even realize I had. Like
Yeah.
growing up, we develop certain belief, coping mechanism, patterns that we fully don't understand where they came from.
Hmm.
And therapy allowed me to step outside of myself and examine my behavior, my fear, emotional responses, and the greater awareness and compassion. and it changed me the way I saw both myself and others, and I became more present in the
Okay.
relationship, less judgmental of myself and others. And
Yeah.
it just gave me an overall understanding of how human nature behave, like how we treat each other, how we behave with
Hmm.
each other. So I think that helped me become a better mother. And I really wanted to do it for my daughter because, even as mom, we sometimes bring on so much generational trauma and we pass it on to
Hmm.
our kids. And we don't
Yes.
even realize. So I really needed to do that healing to become a better mother. And
Okay.
that was my commitment to it.
Yes. Well, shout out to you for being a good mommy and working on fixing yourself. Cause I feel like a lot of us, especially in our age group as millennials, like I feel like we really hone in and we like look at how we were raised and then look at the things that we didn't like about it and figure out like what do we need to fix within ourselves in order to make it easier for the kids. So you're doing the work, mom. So shout out to you. And so before we switch gears, what would be like one thing you would say to another woman who may silently be struggling with that postpartum depression right now?
I just want to say, like, don't let anyone minimize you, how you feel. Uh,
Yes.
like, when people are saying you'll snap out of it, it's just fine, it's
Hmm.
hormones. Um, I don't want you to listen to those people. I want you to understand that pregnancy and postpartum depression are real and you deserve
Hmm.
to be taken seriously. And healing looks different for everyone. Like, there's no shame
Yes.
asking for professional help.
Nope.
Um, I wish, like, as I said, like, more doctors were kind of trained or
Hmm.
to diagnose these early on. But more importantly, like for yourself, go out there, find your support system, build your circle, join like local mom groups, talk about it. If you see like nobody else is talking about it, maybe you take initiative to talk about it, and
Yes.
lean on to people you trust. And just remember, you do not have to go through it alone.
Yes, and I love that. And like you said, if no one is talking about it, talk about it because there may be five people sitting next to you who are going through the same thing, but they're scared to speak up too. So
Right.
now, like, it's a bunch of people that are together that are going through something, but everyone's scared to speak up. So just know that it's normal. Postpartum depression does happen. So don't feel like you're an outlier. Don't feel like you're on an island of your own. Do your research, whether you're on Google, TikTok, I know helps because TikTok has helped me with a lot of different things or whatever, you use ChatGPT, like use your resources or even us, like you've been through postpartum depression. I
Yeah.
haven't, but we can always, if you want to reach out, give you resources or anything that you need, because again, we don't want you to be alone. So those are very good tips. And then, okay, so like I said, to switch gears, I know when we talked about earlier, when we did like our pre call, you had mentioned comparing yourselves to males. And in dentistry, it's a male dominated field, right? So, what did that look like for you? And why do you feel like you compared yourself?
So I think when you're in school, you're all like at the same level, and
Hmm.
like most of us like are still like single or not, like do not have kids. So your
Yeah.
trajectory looks very even, and I feel as a woman, you have to kind of do a little more to prove yourself. Like you have to push
Yeah.
yourself a little extra, or you have to have more achievements to be recognized or be at same level as your male peers. So there
Hmm.
is kind of like that mental pressure that you built on yourself, not the society. I don't know if society builds it, maybe society does, but I
Yeah.
think particularly for me, I think I had built in on myself that I had to do better than male peers to kind of be
Hmm.
at the same level. So when I see like them getting more like learning advanced procedures or rapidly moving
Hmm.
to like leadership roles, or opening their practices or expanding their businesses, while I'm
Hmm.
still like navigating pregnancy, postpartum depression, like major life
Yeah.
transition. And that's when I felt like I was like I'm behind, like I'm behind professionally, and I don't know when I'm going to be able to catch up. And
Yeah.
yeah, and it took me a while to understand like not everybody's career trajectory is going to look the same. Like this is a marathon, it's not a sprint. And it's just my personal responsibility and are taking priorities right now. That doesn't mean my ambition is disappearing. My path is
Right.
going to be a little different.
Yes. And again, I want to commend you because you do a lot of great things and I can't wait to talk about the other things that you're doing. But you're also a mom. Like being a mom, I feel like sometimes it's underrated. Like we do a lot and we do a lot without being asked. And so we
And
never
I'll give you an example. Like
Mhm.
you have kids. So my husband helps me like 50-50. Most sometimes he does more, sometimes I do
Yeah.
less. I think the emotional load that no one talks about, like my daughter had a tick bite yesterday, and um, I was like, okay, I have to call the doctor and figure out what I'm going to do. Do we need to go in? And we were chatting about it, and at no point he goes like, okay, I'll call the doctor. Like
Mhm.
it's given that I'm calling the doctor, and even if
Yes.
he takes it upon himself, he's like, if I assign him the task, like, hey, call the doctor. I have to remind him 20 times. And if he didn't call him, like he'll be like, oh, you didn't remind me. So it's the emotional baggage that happens that, you're kind of like a normal caregiver or an assigned
Mhm.
caregiver for small tasks. And it does take up time. Like, it does occupy part of your brain.
It does, it does. And then, like you said, in the process, again, when you're in male dominated fields, now you're comparing yourself to someone who doesn't even go through the same things we go through because they don't have to go through motherhood and stuff. And so that's why it's important, as I always say, and I've had to learn this to myself, is don't compare because you don't know their chapter 30 compared to your chapter 10 can be completely different, which males versus females, it really is. It's like polar opposites. And like you said, we have to get the same result that they get like this. So that's how society is set up. But we're going to keep pushing forward and keep being amazing women because we're, setting up the road for all the kiddos behind us to be able to have an easier pathway. So I love it. Um, so what do you feel like was the turning point for you when you decided to stop comparing yourself and just fully going your own way?
Well, I don't think so. It was a single moment or a turning
Mhm.
point. I think it happened gradually.
Okay.
After, I think I remember in 2023, I was like simultaneously going through therapy, healing myself. And I felt like as I was saying, I was feeling professionally behind. So I started my fellowship for full mouth rehabilitation, which is like advanced dentistry.
Okay.
Um, and as I started engaging more into my program, learning new skills, getting outside and meeting other professional and other
Hmm.
women, and it was a slow healing process when I started like, okay.
Yes.
And then at the same time, when I started coming out of my shell or a rebirth, if you want to say it, because that's how it felt like. Um,
Yeah.
I talked to more of my friends or a couple of friends that I haven't talked in years who have been mom for like, longer than I have, and
Hmm.
start comparing and talking about these issues.
Yeah. And again, so that was another one. Get your support system, whether it's family or friends, and lean on them. And again, ask them questions, especially if they've been like a parent or walked this path before you, just to get like some type of feedback. And, you'll make the best decision what's best for you and your family, but at least you have something to go off of in real time.
Yeah.
So that's important. And then this is for me as well as anybody else watching. How do you stay confident in rooms where you may feel underestimated?
Honestly, I still get nervous. Like speaking
Mm,
up in a room full of people, it doesn't come naturally to me. I doubt
okay.
myself many times. But I've learned like being confident does not mean like not having fear. Um,
Right.
it's choosing to move forward despite of having the fear. So and also like becoming a mom, I think changed my mind because there were like a lot of things I wouldn't do it before, and now in my head I think like I have to do it because I have to set an example for my daughter.
Yes.
That mommy pushed herself, mommy did this despite of the challenges. So I think I've kind of pushed myself a lot harder because I worry about like I have to leave a legacy behind. uh,
Yes.
but I want to say like if not you, then who? Like I think
Exactly.
like if not me, then who? And I speak up and take opportunity and think like what's the worst going to happen? Like if I
Mm.
the answer is going to be no if I don't even try. So
Exactly.
you can try, and there's like a 50% chance that you get what you want, or
Hmm.
it might be wonderful or it might be amazing.
Yeah.
But if you don't do it, you know that it's not going to substantialize.
Exactly. And what I love about what you said is, if not you, then who? Because I feel like us, especially with us being leaders and females, representation is huge. And like the little kids that look like us, or, they're growing up, we make it achievable for them to feel like, oh, I can do that too, because I can relate to that person. So it's important for us to like really hone in. And like you said, even if we're scared, because I'm scared doing this, but here I am doing this. We have to, for the people that are coming up behind us. So I commend you for that too, because that's huge. Um, okay, so to switch gears, so tell us about your mentorship program at NYU and what inspired you to get involved, because you're just doing a lot of great things. That's huge.
Well, I don't know if I'm doing great things. I think it's just happening. So I'm doing two different kind of mentorship program. The one is the fellowship that I took. I stayed on for a few extra years, and then now
Mhm.
I am mentoring the other dentists who are taking the
Okay.
similar course, fellowship course that I took as a faculty. And this year, NYU started for their undergrad and graduate students to they're starting a women's initiative. It's a pilot program. So where you're
Okay.
matched with like two mentees, and those are like undergrad and graduate students. And my motive to do that is like to inspire more women to get into healthcare and in leadership position, and to guide them, because I feel like women are not like leadership roles are still like very dominated by men. Um,
Right.
I'm thinking more in healthcare, but I feel like it's generalized, like everywhere. I think when you see the leadership boards and like, because that's where the decisions are made, and I
Mhm.
feel like it doesn't focus on women.
Yeah, and so you are doing it. Stop being so humble and modest. You are doing a lot of great things because again, you're putting yourself out there even if you're uncomfortable in order to like lead other people and be a mentor. So stop it. You are doing amazing things.
Thank you.
And I love it. So what's like one piece of advice that you always give your mentees?
So I want to that one of the thing is like that I want to like piggyback on like what I said about confidence is like, even if you don't feel confident, even if you don't feel
Mhm.
ready, um stop like tiptoeing, like jump in, because you
Yeah.
never feel ready. You're never gonna feel like you're 100%. You're never gonna feel like, oh, I'm
Mhm.
confident, because confidence comes in later. You have to start taking steps in, and you'll find your way, and
Mhm.
build the confidence to reputation. Maybe you'll fail like 10, you try 10 times out of 10 times, you'll fail 8 times, but the two
Mhm.
times where you succeeded, that will help you build on to the next building blocks. And it's okay to doubt yourself and feel unqualified, even when you are
Mhm.
capable. But I think that's growth happens if you show up.
Exactly. You have to show up and you have to fail. And like, I feel like successful people know, like, you take no's for breakfast, like, take rejections, like, you're taking it on the chin, like, because it's going to happen. You can't avoid it. And that's where the learning happens. When you fail, it's like, okay, I can do this better. And like every successful person, every billionaire, it's the growing pains and you have to go through the process. So don't run from it, run towards it. And I promise you, once you change your mindset about it, it'll be completely game changing for you.
Yes.
So thank you for that information. And so then now you're working towards creating your own AI tool for dental treatments. What sparked this vision? Tell us about it. What can we expect? Again, that's something huge, so don't say it's not.
Yeah. So, well, it's the idea came from years of working and seeing how much variability there is in
Mhm.
diagnosis and treatment planning, even with like the highly trained clinicians. So dentistry is very complex, and treatment decisions are like often influenced by like your experience, subjective training,
Mhm.
exposure, time of the day, and
Mhm.
how well you know the newer techniques or technology. So, two dentists can look at the same patient, same x-rays, and can come up with like two different treatment plans. And
Okay.
fascinated me because there is no standardization, and sometimes that leaves patients more confused, and sometimes patients think like, oh, who's right, like, they don't know whom to
Yeah.
trust, so they usually go with like somebody that kind of, okay, you don't need any treatment, or that's saying like, oh, you need less treatment. That may not absolutely be correct every time, so I wanted like to make it more consistent, have
Okay.
better clinical thinking, and reduce some of the cognitive load on clinician that happens every day. It's not going to replace like dentists or clinicians. It's going to probably aid into helping and making their thinking more consistent. The
Okay.
goal is never to replace like dentists or human touch or human
Yeah.
treatment, but it's to kind of deeply understand how we make our decisions and support to organize the information that's out there. So I'm very excited, and we're trying the beta version of it. So,
Okay.
and my husband's helping me build it. He's the technical brain behind it, and I'm the clinical brain behind it.
I love that. So whatever you need as far as when you're ready to roll it out, send it to me. I'll blast it out here in the Chicagoland area,
Happy to.
because I think that's huge. And like you said, it's not to replace human touch, but to make things more like standardized. So like you said, if it does deviate a little bit away from the norm, it's not like this dentist says this and this dentist says this. So now who's right? But more so bringing things in the middle. So I think that's huge, and I cannot wait to support. So please keep me posted
Thank you.
on that as well. You're welcome. And so then for the final question, what legacy do you want to leave, not just as a dentist, but as a woman and a mother?
So I think that's a very deep one,
Mhm.
because I feel like as a dentist, I want to be remembered for my clinical work, but not just my clinical work. Like I want to be remembered about like helping other dentists improve their work, innovation, and mainly to like, help change the overall direction of dentistry in a
Okay.
way of like more humanity, balance, and growth. As a woman, I want to say that I want my story to remind others like success is not always like linear. Like it's
Mhm.
seasons of rebuilding, growing, learning, or unlearning, um, but not to define your self worth on certain milestones.
Mhm.
And as a mother, I think I hope my daughter remembers that even when life gets difficult, show up with
Mhm.
courage, faith, and love.
Yes, and I love everything you said because I think it's all important. And like you said, you are changing the dentistry game like one step at a time. And you're starting from the students and letting them know like this is possible. You can start your own practice. You're woman owned, but you're just as sophisticated and successful as any man out here. Like that's huge. And then you're just doing a lot of great things. And I haven't met you in person yet, but I'm so proud of you. And I can just see like the light, you know what I'm saying, coming from you. And you're just going to continue to make an impact. I almost want to cry. I don't know why. You're going to make such a huge impact. Like I see it, I feel it. And I'm happy that God has brought us together so I can help you along this journey and just witness all the great things that are going to come from it. So
Thank
thank
you.
you for being you. Thank you for being successful. Thank you for leading the way. And I don't know what's wrong with me. But before we get off this podcast, please let people know how they can reach out to you if they just want tips about motherhood, if they want to step into the dentistry world, anything like that. How can they reach you?
They can reach me on Instagram. It's Ekta Pandya DDS,
Okay.
and it's EKTAPANDYA DDS. And yeah, they can shoot me and send me a personal message.
Okay, perfect. And I'll drop that information below. And then, like I said, when you start rolling out like everything for the AI, please send it to me so I can repost, reshare,
Yeah,
whatever,
no problem.
in order to help you guys grow. But that is it, guys. So thank you for another Women Empowerment Wednesday. Thank you for being, again, such a beautiful guest. And then if anyone wants to come on here, please, like I said, always reach out to me. I'll drop all that information below. But if you want to come on here, girl talk about entrepreneurship, building your career, being a mom, whatever it is, we want to create a safe space for you to be able to let it out, heal out loud, and then help other people heal in the process too. So that's it, guys. Have a great rest of your Wednesday.